Good day to all. In today's video, let's discuss about sickle cell anemia. So, sickle cell anemia is an inherited form of anemia, which is a common condition in which there aren't enough healthy red blood cells to carry adequate oxygen throughout the body. So, the red blood cell become rigid and sticky and are shaped like sickles or crescent moons. So, these irregular shaped cell can get stuck in a small blood vessels and which can slow or even block the blood flow and oxygen to vital parts of the body. So the main function of hemoglobin is to carry oxygen and predominant protein in the red blood cells. So hemoglobin forms an unstable reversible bond with oxygen. So oxyhemoglobin is that oxygenated, which is bright red color, and deoxyhemoglobin, which is reduced purple blue in color. So each hemoglobin molecule is made up of 4 heme groups surrounding a globin group. So heme contain iron and gives a red color to the molecule. Globin contain of 2 linked pairs of polypeptide chain. So here is a difference between normal healthy RBC cells and sickled cell. So in RBC, in a healthy form, the lifespan is 120 days and the HB has normal oxygen carrying capacity, 12 to 14 gram per deciliter of hemoglobin. But in sickled cell, the lifespan is just 30 to 40 days and HB has decreased oxygen carrying capacity and it has 6 to 9 gram per deciliter of hemoglobin in it. The pathological defects of sickle cell. So sickle cell hemoglobin or a group of disease in which normal adult hemoglobin is partially or completely replaced by a variant HB sickle, which is HBS or HBC. Among other, the molecular structures of these hemoglobin differs. So normal HB contains 4 polypeptide chain, 2 alpha and 2 beta chain, each with a characteristic amino acid sequence. The alpha chain contains 141 amino acids. The beta chain contains 146 amino acids. The precise sequence of these amino acids have established. The nature of the difference between HbA, HbS and HbC is determined by one amino acid in the beta polypeptide chain in the 6th position. So this position is occupied by glutamic acid in HbA, by valine in HbS and by lysine residue in HbC. In all these polypeptide chains, the sequence of the other 145 amino acids is the same. Types of sickle cell disease. So there are 4 main types of sickle cell anemia and it is caused by different mutation in this gene. So first type is hemoglobin SS disease. So HbSS disease is the most common type of sickle cell disease. It occurs when the inherit copies of the HbS gene from both the parents. So this form HB known as HbSS as the most severe form of SCD, which is sickle cell disease. So individuals with this form also experience the worst symptoms at a higher rate. The next type is hemoglobin SC disease. So HbSC disease is the second most common type of sickle cell disease. It occurs when inherit the HbC gene from one parent and the HbS gene from the other. So individuals with HbSC have similar symptoms to individuals with HbSS. So the third type is hemoglobin SB. So hemoglobin SB with beta thalassemia affects beta globin gene production. So the size of the red blood cells is reduced because less beta protein is made. So if inherited with the HbS gene, it causes HbS beta thalassemia. And the fourth type of sickle cell disease is sickle beta 0 thalassemia. So this disorder is the fourth type of sickle cell disease. It also involves the beta globin gene. So it has similar symptoms to HbSS anemia. And the fifth type is sickle cell triad. So people who only inherit a mutated gene HbS, which means so from one parent are said to have a sickle cell triad. So this type may have no symptoms or reduced symptoms. Symptoms of sickle cell disease. excessive fatigue or irritability from anemia, bedwetting from associated kidney problems, jaundice, which is yellowing of the eyes and skin, swelling and pain in hands and feet, frequent infections, pain in the chest, back, arm, or legs. Other clinical manifestations includes in central nervous system, hemorrhage, paralysis, and in cardiovascular system, it includes congestive heart failure, heart rate increased, and in genitourinary, it causes hematuria and diuresis. In ophthalmology, blindness, retinopathy, and in dermatology, ulcers of hand and feet. Complications of sickle cell disease include increased risk of severe bacterial infections, stroke, gallstone, hypersplenism, osteomyelitis. So the diagnostic test for sickle cell disease includes blood counts can reveal an abnormal HB levels in the range of 6 to 8 gram per dl, and blood films may show RBCs that appear as irregularly contracted cells. So sickle solubility test looks for the presence of HbS, and Hb electrophoresis can also be performed. So the medical management for this sickle cell disease includes hydroxyurea and erythropoietin, which increases the fetal Hb, and transfusion therapy can be done. And analgesic like morphine or methadone can be suggested, and nutritional supplements and immunization can help to prevent infections. Thank you.